Welcome to the Coneflower Institute's mini-series focused on mental health issues. In this series, we aim to raise awareness and understanding around common conditions across a range of areas. And in this case, we're going to cover areas such as personality conditions, anxiety conditions, but also things like mood conditions and the related comorbidities of substance abuse and eating disorders as well. Today's topic is OCD, or Obsessive Compulsive Disorder, and we have Joe Brosch from the Coneflower Board to help us shed light on this area. And just for our audience, all definitions and technical information that we'll be providing today has been sourced from the Mayo Clinic. So with that, we'll get started. Joe, let's start with the definition surrounding OCD. What is it that characterizes obsessive compulsive disorder?
Thanks, Mo. I just wanted to take a brief moment to say thank you for having me on to do this. OCD, or obsessive compulsive disorder, features a pattern of unwanted thoughts and fears or obsessions that lead to the repetition of behavior or compulsions. These obsessions and compulsions can interfere with daily activities and or cause significant distress.
Digging deeper into this, we're going to talk about the obsessions on the one hand, the compulsions on the other. The difference, of course, being thoughts versus activities that result from those thoughts. So let's start with those thoughts or those obsessions, Joe. What are some of the top examples of obsessions that folks suffering from OCD tend to have?
Some of the most common ones could be things like fear of being contaminated by touching foreign objects, doubts that you've locked the door or turned off the stove, intense stress when objects aren't ordered or facing a certain way, images of driving your car into a crowd of people, thoughts about shouting obscenities or acting inappropriately in public, unpleasant sexual images, or just the avoidance of situations that can trigger obsessions, such as shaking hands.
And in contrast to that, Joe, what about the compulsions in terms of what are some of the most common compulsions that come from some of these obsessions that you just mentioned?
Many of the compulsions are consequences of the previously mentioned obsessions, and these could take the form of hand washing until your skin becomes raw, checking doors repeatedly to make sure they're locked, repeatedly checking the stove to make sure it's off, counting in certain patterns, silently repeating a prayer, word, or phrase, and arranging your canned goods to face the same way.
And it's so interesting, it's almost like the acronym of OCD has become a part of pop culture in a sense. You hear it in movies and shows, oh, this person is kind of OCD, more as a descriptor of their behavior. And of course, not as a diagnostic term, but, we're of course talking about, the diagnostic connotation of OCD. But I think there's not a lot of information, at least awareness around the treatment side of things. So Joe, let's talk a little bit about that. What's the typical treatment process for OCD?
Well, there's two main treatments for OCD, which are psychotherapy and medications. And oftentimes the treatment is a blend of both of them working in synonym. For instance, psychotherapy, one of the most common psychotherapies that can be done is cognitive behavioral therapy, or CBT. Additionally, exposure and response prevention, or ERP, which actually happens to be a component of CBT therapy, involves gradual exposure to a feared object or obsession, such as dirt, while teaching adequate coping mechanisms. ERP takes effort and practice, but you may have a better quality of life once you learn to manage your obsessions and compulsions. On the medication side, certain psychiatric medications can help control OCD. Most commonly, these are antidepressants, which are normally prescribed first.
Thanks so much, Joe. We hope that this is a helpful, informational video for the broader mental health community. And if you have any follow-up questions for Joe or for our team at the Coneflower Institute, please feel free to share them below in our comments. And thank you again, Joe.
Thank you, Mo. It was a pleasure being here.